This is One-on-One. We're pleased to be joined by Dr. Ohan Karatoprak, who is the Wellness Director at Holy Name Medical Center. Good to see you, Doctor.
Good to be here.
You're taking care of your people at Holy Name. They're a lot healthier now, right?
They are healthier. They are.
How'd that happen?
Well, a couple of years ago, we started a wellness program at Holy Name Hospital. And we decided to screen our employees with certain parameters, like body measurements of the blood pressure and waist circumference and body mass index. And then we did some blood tests to see if they have any problem that they can develop chronic diseases, so we can prevent them before they do that. So we do wellness. We do get measurements, body mass index, waist circumference, and then blood pressure. And then the other measurements are lipid profile, which is cholesterol profile. And then we do hemoglobin A1C, which is indication for if you are pre-diabetic or you have diabetes. And we do vitamin D level. All these things, 5 items actually, besides vitamin D, gives us something called metabolic syndrome. If you have 3 out of those 5s, you have high risk of developing chronic diseases, like heart disease, diabetes, cancer, high blood pressure.
And you've identified a lot of things.
Right. We can identify, we can see really how many of them have this metabolic syndrome, and we guide them to see their physicians, we guide them to treat them properly. Besides that, we do obviously smoking cessation, we do exercise, all that together.
What has been the reaction of the employees?
Actually terrific. And we did initiate a weight loss program for them because we have obesity issue too. As you know, in the nation, we have in the hospital the same ratio, 1/3 of the employees are obese, and the same in the nation.
What kind of success have you had?
Terrific, actually. And because we don't have this, obesity treatment is not a one type of treatment. It's not. It is personalized. So we categorize people. We see the body style and body profile, and after that we put them on one of the 8 different programs. Like somebody could be a normal weight obese person. I'm talking about normal weight obese because obesity is not a weight issue.
Right.
Obesity is an over excess body fat issue. And somebody can be under-eater. We call under-eater because they eat less than 1,800 calories. They shut down their metabolism. Actually, we created so many people in the United States with, I call them low-calorie dieter syndrome. It is with the low calorie, they shut down their metabolism, they lose weight, and they gain back again more, and now they have lower metabolism. They're actually in dead-end street. So we categorize obese people first, we put them in profile, and then we have one of the 8 programs that fits for them, and we do that. Let's say if somebody is really not eating properly and is under-eater, we feed them more. Somebody is over-eater, we cut their feeding.
But it's very personalized.
Personalized, completely. And the exercise is the same way. If you over-exercise, actually, you can harm the body, you screw the cortisol, and then we cut their exercise. If they're under-exerciser, we make them properly exercise, and we give them certain supplements, depends what they are.
Doctor, this wellness movement is huge. Why is that?
It is because first we have to start from our own home to get really people healthier, as we have our health organization in the hospital. But we see that the health trend is really because of the obesity, because of all those chronic diseases that's coming up in the United States more and more, and obese people are getting more and more. We are seeing more chronic diseases, and then our life expectancy is not increasing anymore; it's plateaued. As you know, we're number 17 in the world now as a nation. We're not anymore first or second or third because of the obesity taking off, really. That has to be controlled somehow. But it's so difficult to explain to people that by under-eating, which all the programs, majority of the programs out there, cut the calorie down for people, and they lose weight and they shut down their metabolism.
So sometimes they have to eat more, but eat certain kinds of food.
Exactly. Eat more and proper food, though. Because let's say if you're eating 2,000 calories and you're gaining, they put them on 1,200 calories. Instead of saying, okay, let me adjust your food and let me adjust your exercise, increase your metabolism. As soon as you put them on 1,200 calories, there's 800 calorie difference. They lose some weight, but it comes from water, fat, and muscle, and now their metabolism is shut down. So you have to bring them up again. As a matter of fact, what we did was that, in our hospital, when first 100 people they enroll for weight loss, we tell them, bring us your diary. 1 week of diary to see what it is. So what we saw was that 70% of our 100 people, they were eating less than 1,800 calories, and they're obese, and they are here for me to help them to lose weight. So immediately what we did was that increase their calorie up, and depends on their exercise profile, adjust their exercise, and they start to lose weight. Actually, they were complaining, I'm eating too much, what am I going to do? But meanwhile, losing weight, then suddenly they realize, oh my God, this is how it works.
Doctor, I'm going to ask you this, time we have left. How rewarding is this for you?
Well, it's terrific, obviously. I have started this a long time ago. At Whole Name Hospital, actually 25 years ago, we had a weight control center at that time. But it was a low calorie like now old people do. Now I realize at that time that, oh, this is not the way to do. The obesity is a totally different disease. It is not weight, it is excess body fat. Like you can be normal weight and obese.
Yes.
Yes, because we do measurements. Waist circumference is the key, actually. It's not the body mass index. If you take the body mass index of somebody, let's say if it's overweight, you don't know if that person is obese or normal unless you measure the waist circumference.
We got to do the waist circumference.
Waist circumference. Let's say if you are a bodybuilder.
Few seconds left. Go ahead.
Yeah, and then body mass index is really high, 35 or so. And then if you measure the waist circumference, it's normal. This person is overweight with over muscle, nothing to do. On the other hand, if your body mass index is normal person, you get in the picture, and then suddenly you measure the waist circumference, it is big, that person is obese. So you have to treat that obesity.
Doctor, you've taught us a lot in a very short period of time. I want to thank you, and we invite you back to continue to talk to us about wellness, not just at Holy Name, but for all the rest of us who are trying to deal with this issue. Thank you, Doctor.
Thank you very much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by TD Bank, Bergen Community College, New Jersey Council of County Colleges, New Jersey Natural Gas, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, and by the law firm of Gibbons, P.C. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.